Hello everybody, welcome to the EM Code. I'm Dr. Wajiha, emergency physician by occupation. Join my quest in asking right questions from right people to get right answers. Our guest for today is Dr. Aniek Crombach. She's emergency physician by occupation. In addition to that, she's working with doctors across borders, has amazing things to share with us. She's a doctor on the ship, has traveled the globe all over. As a female emergency physician, I definitely look up to her. Welcome to the EM Code, Dr. Aniek.
Hello, as you said, my name is Dr. Aniek Crombach. I am an emergency physician from the Netherlands, and I'm very excited to talk to you, and thank you so much for the invitation.
Let's begin from square one. How did the idea of emergency medicine strike you? What kept you here for so long?
So I love emergency medicine because it really fits with who I am. It's versatile, it always changes, it's never boring, it can be very chaotic, which really fits with me as well. But most importantly, you can be of a really, really big value to the patient. And the most sick moments or anxious moments or stressful moments of their lives, you can really make a difference for the life of the patient. And for me, this is one of the most important things. Besides this, what I really like about emergency medicine is that we look at the patient in a holistic way, the whole patient. And I do believe that this is the best way of practicing medicine. And this really fits with me as well, not just to look at one part of the patient, but to try to look at the whole body and the whole patient, and also the mental well-being of the patients that we help. Besides this, what I really enjoy is that we work in a team. So you work really closely with the nurses, but also with all the extra assisting staff. And besides this, the students and the young doctors in training. And without them, without this team, I wouldn't be able to work and I wouldn't be able to function in a way that I do right now. So this for me is really important, to value each other, respect each other, and work together.
The holistic approach of the specialty itself makes it very unique. Talking about your experience, I cannot not ask you about your experience on the ship, on the planes, across the sea. Tell us about your experience so far after finishing your emergency medicine residency.
I've been trained as an emergency physician in the Netherlands, in the north of the country. And after my specialization, I've been working abroad with different humanitarian organizations. I've worked for small German NGOs, but also worked for Doctors Without Borders. With these small German NGO, but also with Doctors Without Borders, I've been working in the Middle East, in Syria and Iraq. And I've been working on the Mediterranean Sea, on the rescue ships, for people that try to cross the Mediterranean Sea. In this setting, I've practiced mainly emergency medicine, but also primary healthcare in some of the environments, some of the projects. And I've worked with this in less developed, but also less resourceful and very remote environments. Right now, I'm working in a hospital in the north of the Netherlands in the emergency department. So here, the situation is totally different again compared to less resourceful and more extreme situations. Besides working abroad as an emergency physician, I also went to South Africa as part of my training in emergency medicine. In South Africa, I worked in a township in Cape Town. This is one of the largest townships in the country, and in this area there's a lot of violence and a lot of poverty. So besides working for humanitarian organizations in the Middle East and on the Mediterranean Sea, I also worked in South Africa in a township in a really remote setting with a really low resourced environment.
Oh my God, I'm having a major fear of missing out amazing things. Tell us about the differences you have had in developed, developing, and underdeveloped countries. What were the restrictions or limitations you had? What were the kind of cases you had to see?
So working abroad, what I've experienced is that emergency medicine is the same everywhere. What I mean with this is that the sort of patients you see and the diseases are very, very comparable. Of course, in very remote settings or in tropical areas, you can see different kind of diseases like HIV or TB than that I see here in the Netherlands or that I see in the Mediterranean Sea. And in Mediterranean Sea, what you see are patients that are more exposed to the environment and have injuries related to this. And in war areas and war countries that are still in a conflict, like in the Middle East, you can see war-related injuries. Even though emergency medicine is very comparable, there are of course differences between these areas. This depends on how well developed the specialization is there and how well developed the training is. So for instance, in South Africa, there were not a lot of resources, but the training, the specialization is really, really well set up and well developed, and it's based on the English system. Here in the Netherlands, we have a really good specialization and emergency medicine specialty, but we haven't been here for a very long time. So we have less established ourselves in the medical system. In the UK, this is very different again, of course, because the specialty itself has been there for a longer time. And in the Middle East, it is again less developed because of the conflicts that are there and the way that the system is set up. What I do see is that what is something that you can always learn is the basis. So attention for specialization, and attention for training of minors and young doctors. So what this means is that, for instance, in the Middle East, the basis was something that could still be worked on. How do you write down your history? How do you do a proper examination? And how do you use the ABCDE method in the best way? I think there's still a lot of variety in this, and this is something that could be more worked on together, let's say, to have a more general global approach. And I think that the ABCDE approach is really good for this, but the quality of the supervision that is there and the quality of the training that is there is very different in different countries.
Tell us more about Rescuerships, the challenges you have, the thrills, the best and the worst parts. I am really curious to know.
So when we are at sea, there's actually a lot to do on the ship, because you're not only part of the medical team, you're also part of the crew. So this means the seaman crew. So we have a very kind of determined schedule. I wouldn't say strict, but it's quite fixed. And this starts with the morning meeting, and then after that you have cleaning of the ship, daily cleaning. And then after that there's always a lot of work to do on the ship, maintenance work, but also preparing the boat for the people that we rescue. So to prepare the blankets, to make sure that the food is organized, but also to make sure that the medical clinic is well set up, that you have enough medication, and that you have everything in stock and ordered well when you get people on board. So it's never really boring. And even in the downtimes when we have finished our day of working, it's always very cozy, because you're on the ship with at least 20 people, and these crew members are mostly very sociable and enthusiastic to be there. So you have a lot of fun, you eat together, you cook sometimes if you want, you do games, and you watch movies, etc. And after this, when the beginning of the mission has started, you are on the watch schedule. So you have a very clear watch schedule where you work 4 hours on, 4 hours off, 4 hours on, 4 hours off. So in the times that you're off, you really like to sleep or just to relax, and it's not really boring and trying to do something. There's enough to do on the ship.
Indeed, it's a different aspect of emergency medicine, and the limitations make it very unique in its own way. It's so not cliche. When you are on the ship, it is understood that the resources you have are very, very limited when compared to a regular ED, the resources they have. So how do you manage to stabilize the patient till you reach the shore? What are the challenges you face? Talking about the burning topic of gender discrimination that I ask every male and female emergency physician that I talk to is how different have you been treated as a female emergency physician across the globe? Like, you've worked in the Middle East, you have worked in the West. How has your perception been and how have you dealt with it?
So in the scenario that I have a really unstable patient and I need to make sure that they survive until the medevac is there, the medical evacuation is there, I would be able to put them on a monitor. We don't have a ventilator, but I would be able to use a mask balloon if I want to ventilate them for a longer time. And in other scenarios, when they don't need ventilation, I have a lot of medication on the ship, so I would sort of be able to stabilize them, but it would be definitely a difficult situation. Of course, I've experienced gender discrimination. I think that almost every woman has, and especially female doctors have. And what my experience is in the Netherlands that historically physicians are mainly male. This is definitely changing. 80% of the students that graduate right now are female, and also in the hospital we notice that the majority of the doctors are becoming female right now. But still, historically, the context is that there is a kind of masculine world. It's a paternalistic system, and it doesn't change that. Besides this, I'm a young female doctor, so I've definitely felt not taken seriously, respected, or seen as the doctor that I am, mainly by male colleagues, but also by patients or other employees that you work with in the hospital. This is also something that you come across in the humanitarian field. Of course, in every setting you have it. In these environments, it might be a little bit less because human values and respect and discrimination, anti-discrimination is something that is really valued very highly, but you do come across it as well. That said, my experience, for instance, in the Middle East, where I came as a young female doctor, was very good, and I was taken seriously by most of my colleagues over there, where whilst I was working in a society where there's definitely a really big difference between men and women still.
What are the different phases of emergency medicine you have seen? Which is the most interesting one? Okay, now you have traveled all across the world. So what's that one thing you have seen that people have in common with respect to the emergencies, their perspective towards health? Or is that one thing you have found in common?
So the one thing that strikes my mind when you ask these questions about what is something that you see everywhere is that every person, every human being, the only wish that they have is to have a life of happiness and peace and prosperity in a healthy condition. And we would do everything and anything to make this happen. People flee for this, people do horrible things for this, just to make sure that they are okay and their family is okay. And all we want is to have happiness and peace and be able to have a job to provide ourselves and our family with food and money and clothes and a roof over our head, which are very only, you can think maybe very basic wishes, but this is something that every person wants, and this is something that binds us all together. And if I believe that if we understand this from everyone around us, if we understand that people don't flee because they want to, but they flee because they don't have another choice, because otherwise they don't have a life, then we would also have more compassion for each other, and I think the world would be a much better place.
2020 has been different for everybody for various reasons. Some people lost their loved ones, some people lost their freedom, somebody lost their mental health, somebody lost their finances. So how has the lockdown affected you? How were your experiences like? What were the best and the worst things you have carried all through this year?
Of course, working abroad, and especially in the Mediterranean Sea, is more difficult than now during the pandemic. But for me, working in the Mediterranean Sea is still much closer to home than going to other continents, because then it's even harder to fly or to get there, to get to remote settings. And also, because I was working in this area, I had, like working in the Mediterranean Sea, I had reasons to travel. And it actually wasn't so difficult. So of course you need to do a PCR test and you need to do quarantines. but I was able to move still. I was able to go to another country. I was able to enjoy the beach in Spain, for instance. And I don't think many people can say this. So I actually think I'm quite lucky that my work still gets me to have these opportunities and to move as much as I can, even though the pandemic is there, because there are many people that can't even leave their home, and I still have the chance to go to the Mediterranean Sea on a ship or to move back home again.
Across the path you have, did you find any mentors? How important is it to have a mentor?
Yes, I do believe that I have a very special journey. And I don't have a mentor. I did not really have a mentor either. I think I've really found my own way by just trying and doing and learning from it. But I did have a really, really nice supervisor, very smart, kind, really, really cool doctor in South Africa when I was doing my internship over there during my specialization. And he was definitely my example, a really good example for me.
Surely the role of mentor is very important. They can show you the direction, but end of the day, I think you choose your destiny, you work towards your destiny. But yes, right direction is pretty important. There are a lot of people like me who are interested in working across doctors, across borders, and people who are interested to work with MSF. How do they reach out if they have any doubts? What do you think is a proper resource?
So what I've definitely learned from working in the humanitarian field in remote settings with low resources is how to do a good examination, a history and examination actually, and make a diagnosis without having a lot of diagnostics. So I've been working in settings where there was really limited blood tests. Maybe there was only a blood gas, and if there was more, there was maybe an HB and a kidney function, if that was what we had. Sometimes not at all, like on the ship. Luckily, working on the rescue ship, it rarely is the case that we have very, very sick people. These people are mainly young and do have diseases, but are quite, how do you say, resilient. And so yeah, with this question you've definitely also reached a subject that I've been thinking about, namely that it's not so easy to find information about working as an emergency physician in the humanitarian field or abroad in low resourceful settings for different NGOs, for instance. And I do think that there's something that we can improve here. I'm very excited about this, and I'm really happy to help anyone who also wants to work in this setting, in this field, or wants to know more about different kind of opportunities that are there or organizations. So don't hesitate to write something in the comments, and then we can either contact you or follow me on Instagram at dr.rugby.inthefield. Yeah, let's talk about what you like to do, and maybe I can help out. Okay.
As an emergency physician, how do you find it different? How different is working on the ship versus working in a routine ED? What are the challenges you face? How does the camaraderie go? Basically, tell us about your life as a doctor on the ship. Tell us more about Rescuerships, the challenges you have, the thrills, the best and the worst parts. I am really curious to know.
So the first time that I joined one of the rescue boats and went to sea, I really loved it. I love the sea. I love to go surfing or swimming or just enjoy the beach. So I was very excited to go out to sea. I was also sailing on the Sea-Watch 4, which is a really large boat and it's quite stable. I think it's around 17 meters, but I'm not quite sure how big it is right now. And with this, you don't have a lot of movement of the ship with the waves. So I actually really enjoyed the sea. It's very calming to look out, to look at the waves, the sunrise and the sunset. And there's a lot of silence if your boat doesn't make too much noise, and this one didn't. So yeah, I was really enjoying this experience the first time. The second time was a little bit different. I was on the Sea-Watch 3 and we had a lot of wind and waves. and the boat actually moved a lot. So I actually got quite a bit of seasickness, which made me lie in my bed for the first days most of the time, unfortunately. After this, when the sea stabilized, I did enjoy it as much again, to be out there and enjoy the calm and the waves and the sunset, sunrise, but also the stars. Traveling on the Mediterranean Sea on the rescue ships, I think made me more wiser, made me more patient, and made me more understanding of how the world works, how politics works, and how the system works. And this is something I believe very valuable, not always easy, because it is also very sad and frustrating sometimes, but it definitely made me also more thankful and more appreciative of what I have, and more grateful of what I've achieved so far, and also where I live, to appreciate this more.
What was the most interesting case that you have handled? And, without your interventions, the patient's condition would have turned havoc. The case that you recall gives you butterflies in your tummy. What is that case? Please share with us.
So there's one case where when I was working in Syria, of a young baby that was only a couple of months old, and it came into the department not responding and not breathing well and not having a proper heartbeat. And the patient was brought in by the parents, and the nurse was doing the examination, and I saw the baby, who was floppy and gray and not breathing well, and I immediately started acting, because I thought, oh my god, this patient is either having an arrest or going to go into arrest very, very soon. So we started giving fluids, IV needle, and I started to breathe, ventilate the patient, ventilate the baby. And in the end, I had to intubate the patient because she wasn't breathing properly, which was something that at that time, when I was just graduated as an emergency physician, I hadn't done many times. I hadn't intubated many babies, because in the Netherlands this is always done by the pediatric anesthesiologist, and in a remote setting in Syria you don't have this, so you're the only one who's capable of doing this. And in the end, the patient survived, the little baby survived and got better, which was really surprising to me, because I really thought that I was going to lose the baby, but she didn't, and she survived. So this is something that I don't think I'll ever forget, also because I was really stressed and really afraid that what I was doing wasn't good enough.
Thank you so much, Dr. Aniek. I'll drop down the link below in the description of the video, where people can put down their questions in the comments and can reach out to you. Thank you so much for your time. I know you have a busy schedule, and I have been bugging you for months together. Thank you so much for taking time out for us. Thank you so much for joining the EM Code.
So thank you so much for the questions in this interview. I'm very excited, and I hope that this was something interesting for all of you. And good luck with all of your careers and your work and your life. Bye.